Welcome to My Nurse Specialty, a podcast for nurses who want a clearer view of what's possible in this profession. Real nurses, real stories, and real possibilities. Welcome to My Nurse Specialty. Today I have a great guest. I think that you're going to love her as much as I do. She is someone that I recently come across with a referral that we got, and she is an ICU nurse, but she has a lot of ICU experience, and I'm so excited to have her as a guest today. And so I'm going to have her introduce herself.
Thank you so much for having me. My name is Jessica Nelson, and yes, I have been a nurse for 24 years, and I was very fortunate to be able to go into the ICU as a new graduate, which 24 years ago was very rare. That was before residency programs or anything like that. So I was very fortunate to be able to go into the ICU. I grew into a neuro ICU when my hospital got specialized with neuro. I was one of the original nurses who got trained to be a neuro ICU nurse. And so the majority of my career has been in the neuro ICU. There was 8 years there that I stepped away from the ICU and did interventional radiology. And that was a lot of fun, but you could take the girl out of the ICU, but you could never take the ICU out of the girl. And when my kids were little, I went back to the ICU and I worked night shift for a little while and just really kind of dove in. And then 2020 COVID happened. And, that's probably another podcast episode all in and of itself, but really learned a lot during that time period. I've also been a nurse manager for a couple of years, and the last 3.5 years of my career, I have been the ICU educator in the same ICU where I started my career. So I've been their ICU educator for the last 3.5 years, and I teach all things ICU. I'm very passionate about everything critical care, and I'm really excited to talk to nurses who are thinking about starting or moving their career into the ICU.
Yeah, we hear so much about, don't start in the ICU or, go ahead and start in the ICU and it's okay. And I have talked to nurses that have started in the ICU. And what I love is that you're giving a different insight because now you're an educator too.
Yes.
So, what do you think about nurses starting in the ICU as a new grad?
It's not for everybody. I do think that you have to have a special skill set to be able to start in the ICU as a new grad. It was very difficult for me 24 years ago, and the amount of technology that has come since then has leaps and bounds. So there's even more for the new nurses coming in to learn. Not only are you learning how to be a nurse, but then there's a whole learning curve of critical care medicine that's out there that you have to be able to learn and understand. Looking back now, I think that there were a lot of concepts that I really didn't understand fully, even though I got, education from a nurse practitioner, to be able to be an ICU nurse, but I don't think I fully understood all of the critical care concepts. So I think now as an educator, I would recommend having some, time on a med-surg floor or even a step down floor, if possible, a year or 2 years, just to learn how to be a nurse and take some of those basic concepts now into the critical care realm. I have taught both new grad ICU nurses and nurses who have a couple of years experience, and I feel that the step down nurses in particular are grasping the concepts that I'm teaching them so much faster than a new grad that's fresh out of school.
Okay, that's really good to know that for a nurse that is brand new and this is where they want to go, it's always good to have an idea where you want to go. But when you start, sometimes that idea can shift of where you decide. But if someone's decided, yes, no, I still want to go to ICU, I still want to go to
Mhm.
ICU,
Mhm.
then the strategy here would be for someone to start in maybe med surg, move to a step down, or even start in a step down
Yes.
and then start learning all and grasping everything they can, and then make the transition to an ICU.
Yes. And not saying that it cannot be done as a new
Right.
grad. It absolutely can. It is very difficult. And like I said, you have to have the right personality and like, I mean, the go-getter personality is, you know what I'm talking about. But you have to be willing to work really hard to be a new grad in the ICU. Not only just learning how to be a nurse, but again, learning all of those critical care concepts that come along with being a bedside ICU nurse.
Yeah, and there's a lot of nurses that go, well, they start off in a different area of nursing or even an aide or a tech or something, and they've been in those areas. And so when they graduate, usually they're the ones they are usually know, I want to go this route. And so that would probably be a different situation, like individually, who would be a good candidate to move over to the ICU. And if you don't get the job, because when nurses sometimes get so defeated when they are in that time and then they go and they try to get the job and they don't, that door closing doesn't mean it's not going to open later. It's good to just keep getting your skills, go into a step down or even longer in med-surg or another area and then try again.
Absolutely. And you made a good point about, being a tech, or we call them nurse externs now. Back in my day, I was a nurse associate, which I was a unit secretary in the ICU before I became a nurse. That 1 year of a unit secretary, being immersed in that environment,
Mhm.
I think helped me to become an ICU nurse better as a new grad rather than just stepping into a hospital for the first time and not having that experience. So, yes, we do have, our nurse externs who are in nursing school, then they graduate, then come into the ICU as a new grad. That way, I feel like those nurses even are more successful than the ones who maybe didn't work in healthcare prior to becoming a nurse.
We talk about shadowing, right? And we'll tell a nurse if you want to go into that area, shadow. But shadowing doesn't do the same as somebody who's going to work every day as a unit secretary, an extern, or an aide, or
Yes.
an assistant, or some type of capacity in that environment to actually see what's happening on a day to day.
And you are interviewing for that role as you are working there. So if I am working in the ICU as a tech and I have that go-getter attitude where I'm at the bedside, I'm asking nurses questions, I'm going around, hey, you want to turn your patient? Hey, can I do your patient's mouth care for you? Anything that I can do without being licensed and I'm
Right.
jumping in to do it, that already tells that nursing leadership, I want her when, or him or her when they graduate from school, because that's the type of attitude that I want in this unit.
Right. Very, very good point. I'm glad you brought that up. I just did an episode on networking too. And we're talking about,
Great.
what networking looks like. And that is a
Hmm.
form of networking. And if you're in a job, not even just ICU or anywhere as some type of capacity on that unit, yeah, whatever you can do that isn't, going to require that license yet, go in and
Right.
ask. And even asking all those questions are so valuable.
Agreed. Agreed. Yeah, I learned a lot when I was a unit secretary. Back then we had to learn how to read doctors' handwriting. And then when I became a nurse, I already had that skill because I had to do it as a secretary to put in orders and stuff like that. So, we don't have to worry about that anymore, thank God. But that was just one piece of valuable information that I got prior to becoming a licensed nurse.
Good. Yeah, that's really good information. So we are talking about that environment. Let's talk about
Mm.
that environment. What is the day-to-day in your environment? Which one are you going to talk about? Because you have a couple different views. What is the ICU environment? Because I mean, I'm going to say this, that sometimes nurses want to go in because they're hearing about the lower
Right.
ratio, and there is a reason for that lower ratio. So what is the
Mhm.
day-to-day on an environment for the ICU?
Yeah, that's a great question. I am the educator over three ICUs. We have a very high acuity cardiovascular ICU where they take fresh open hearts out of surgery. They might do 3 or 4 of those a day. They may have 5 to 10 patients on cardiac devices like ECMO, or both. So I would say that the cardiovascular ICU is very busy in the fact that there's a lot of devices going on and the nurses are managing those devices. The medical surgical ICU, let me just say that medical surgical ICUs and medical surgical nursing is a specialty all in of itself because you have to know it all. You're not just siloing yourself into cardiovascular or neuro, you have to know it all. So that unit can be very busy because those patients are very sick. We're getting the shock patients, and they're on multiple vasopressors, ventilators, and all that stuff. Then we have our neuro ICU, and we're getting strokes all day, every day. You don't know when the strokes are going to come into the hospital. You can never predict. How many strokes are we going to have today? Well, we might have 0, or you might have 6. It just kind of depends on, which way the planets are aligned that day that we're going to have that many strokes. So I say the busyness or the environment is very different depending on which ICU you're in, because they're all very sick. It just depends on what part of the body is very sick. So, and then the nurses, you were correct in that there is a lower ratio. Sometimes it's just one. We just have one patient, but that patient could be on a device that is supporting their heart. They could be on multiple vasoactive drips that I am having to move up and down every couple of minutes to maintain an adequate blood pressure so that we can keep cerebral perfusion pressure or, organ perfusions. They could be so critical that they are on the verge of dying or cardiac arresting. And it takes a lot of work to keep those patients alive. So when you do have that one patient, that one-on-one, it's because you are working really hard to keep that person alive. Normal ICU nurse to patient ratio is 2 patients to 1 nurse. And again, we're doing everything. We don't usually have patient care techs or patient aides or anything like that that are doing our vital signs for us, our blood sugar checks. In my hospital, the nurses do all the blood draws. So I don't have phlebotomy coming and helping me. We're doing all the bed baths. We're doing all the ADLs that they need, as well as closely monitoring their vital signs every hour to every 30 minutes, every 15 minutes, maybe doing neurological checks every hour. So that ratio ensures that I don't miss anything, right? I need to be in that patient's room more than once an hour, usually, to make sure that they're doing okay, that I'm not missing any small changes, minute changes in their status that maybe could tell us that something's going wrong. So these patients are very sick. On the rare occasion, we will have 3 patients to 1 nurse. If you talk to any ICU nurse, we call that being tripled, and we don't like that because that is now I have 3 critical patients that I have to take care of, and there might be an hour that I can't get in that room more than once because I have to be in more than one place at the same time. So, but that's about, the acuity and the patient ratio that we have. These patients can change in a moment's notice. So being able to be in that room several times or having them very close to me, a lot of times when, especially in my department, we have a little desk and then we have windows and we can see into both of the patient's room at the same time, which is nice because then I can almost be in 2 places at once, but they have to be watched so closely because they can really change and deteriorate very quickly. So I hope I
Okay.
answered that question.
No, you did. My mind is going, oh, wow, that's a lot to look and navigate on, a shift. And I was thinking about your triples. Is there an intent to like make that the acuity levels a little different, or is it just the luck of the draw for the day?
Well, it's the S word, staffing, right? So if I don't have enough nurses today, I can't get rid of the patients. So we have to figure out how to get that patient taken care of. And sometimes that means that we have to increase our ratios a little bit. It is never the intent for us to have 3 patients. It
Oh,
just sometimes happens that way, unfortunately.
Right. Okay. I was just kind of wondering when assignments are made, et cetera, it's like, okay, you can take this extra one because we're pretty much going to transfer that person out. You know,
Right.
they're a little bit more, they're getting more stable and we're transferring to a floor. Wondered if that was the idea, but yes, you're right. Sometimes it's just unavoidable and you just have to go with what
Yeah.
you go with.
And they do, take into consideration the lower acuity, patients will of course put those into a triple rather than somebody who's critical, has more things going on with them. We may not have that person be in a triple. But again, these are ICU patients for a reason. So even if I do have a trio of patients, one of them can turn like that. And, that's when you kind of advocate for yourself and you tell your charge nurse, I can't do this. You have to protect your patient, but you also have to protect your license.
Right. So any floor that you're on and those kind of situations happen, you have to speak up and
Absolutely.
yeah.
In a nice professional way.
Of course. So what is like the most rewarding part of working in these very critical areas?
Uh, Such a good question. And I was actually like pondering this on my drive home, thinking about our conversation today. You know, when you are caring for somebody in the critical care unit, it's pretty much the worst day of their life. And my goal is to, when I am taking care of you, when you're in that ICU bed, is to bring you some calm to the storm, to let you know that I'm going to take the very best care of you as if you were my family member. And that today, this 12 hours of my shift, you're going to be in good hands and I'm going to try everything that I can to get you better today. So I think just for me, when a patient or a family member says to me, oh, thank you so much for caring for me today, or you're the best nurse that we've had, not to compare myself with anybody else, but those are the things when they say those things
Mhm.
that I made a difference in that person's life today. And that is always my goal. I didn't mention in the opening, but I do still work bedside. Even though I'm an educator, I do work per diem. I pick up 2 shifts a month at one of our sister hospitals. So I still get to do that. And every shift when I'm walking into that unit, I pray and ask God to help me to make a, a change, make a difference in somebody's life today. Help me to help somebody today. Of course, it's always rewarding when they are leaving the ICU and maybe they were really, really sick and you weren't sure that they were going to make it. And then they turned the corner and you get to watch them or you get to transfer them out of the ICU today. And then even better is when they get discharged and a couple months later, they come back and they see you. And you're like, you get to see them in regular clothes and as a real, a person. And that to me is so rewarding, is just knowing that, I had a hand in saving that person's life.
Yeah, I can imagine how rewarding that must feel
Yeah.
to when seeing them come. You probably don't even recognize them. They have to say, "Remember me," right?
Right. Sometimes when I'm at the grocery store, I'll see somebody and I'll go like, how do I know them? I'm like, I bet you they were a patient I took care of.
Yeah. Yeah, you to see them at their worst, right?
Correct.
So, now they're up and moving and so thankful and, you
Yes.
know, we're,
It's it's
yeah.
very hard. It's very sad. It can, we lose people because we are in the critical care business, but it's the wins that, that's what keeps us going to the next one, to the next one, to the next one.
Yes, yes. So definitely a specialty with a lot of things that you have to manage and the day, and which is why, we hear about the ratios being 1 to 2,
Correct.
and or even sometimes if you can, the 1 to 1s if they can do it.
Yes.
Yeah.
Sometimes we even have two nurses to one patient, depending on what's going on. Like if they have multiple devices and stuff like that, you need more than one nurse in that room.
Yeah, that's good to know that that's how it's done, on if you're that patient,
Right.
you're going to want everything that's the best. And if you have to have 2 nurses, then 2 nurses, if they're able to get in there and we have the staffing, then, that's
Yes.
good. I bet you probably sometimes they'll have to even put two on one and give another one a triple just to see on the needs of
Right.
the patient.
Exactly, 100%. That happens a lot.
Yeah, so all the changes. So we did talk about the worst days too as well and the best days at the same time.
Yes.
And then now into your educator role, you have worked with all nurses in all different levels of coming in, from brand new to mid.
Mhm.
And what do you see them as having like positive in grasping, and what do you give them to like really help? Because I'm sure as a nurse, I mean, you've got this learning curve and
Yeah.
you're coming in, you're anxious about, making sure you don't make a mistake, right? That's, scary. And so
Yeah.
how do you help them through that? And what can you give even nurses listening who are in that position in the ICU right now learning that would be
Yeah.
helpful?
Oh, yeah. There are so many resources out there now that I wish we had 25 years ago or 24 years ago when I became a nurse. There's channels that I absolutely adore, and I still listen to podcasts even now in this point of my career. I wish that we had those. So I would encourage nurses who are looking to go into ICE to start your own studying, right?
Mhm.
You're going to get training. Okay. And for my nurses, for the brand new nurses, they go through a residency program that is 13 weeks long. And then I offer live ICU classes. I have a 6-week class. It's one class a week, and I offer it quarterly, and I go over all like the basics of ICU, hemodynamics, drips, vents. I have a neuro day, which is my favorite day. I try to do like a multi-system day and then emergencies like that. So I really kind of just scratch the surface, but it's to help give you a base of critical care. And I think it's important for the nurses to take those classes and try to apply them to the bedside, of course, when you're there, but then also do your own studying. Like, you can't hear hemodynamics enough, in my opinion. You hear it one time, but then you have to go back and reread and rewatch YouTube videos, go back and look at your notes, apply it to a patient that you had today to be able to really maintain and keep that understanding of critical care. So my recommendation is, yeah, find a class, right? If your hospital offers ICU classes, get into those, attend them, take good notes, but then also do your own studying on the outside. I tell my nurses all the time, I have a specific ICU YouTube channel that I kind of refer them to. And I'm like, you watch these videos, because you're going to hear it again in my class. And it'll be good if it's not the first time you're hearing it. And then go watch it again after class so that you can get a better understanding.
Oh, okay, that's really good. I like that. It keeps them learning even outside of your classroom and talking to you one on one. And
Yes. And then, I get to go, I'm not in the classroom all the time. That's the great thing about being a clinical educator, is I get to go be on the unit. So I kind of target out my new nurses. I go find them and I talk to them. I'm like, "Hey, what do you got going on today? Oh, you have these drips. Remind me again why they're on those drips," right? So I make them think at the bedside, and it gives them an opportunity to apply that knowledge that we learned maybe just this week. Maybe we just did ventilators this week, and now you have a patient on a ventilator. So let's look at what kind of settings they're on and all that stuff. One of the things that I also try to incorporate in my classes is talking to them about patient scenarios. So if I am talking to you about a shock state and I'm telling you the hemodynamic parameters in this shock state, it's going to make it easier for you to understand if I give you a case scenario, like a case study, and say, I had this patient with XYZ, and this is what happened. And it will bring the concept that I'm teaching them into a real scenario that they're like, "Oh, wow. Yeah, I can see how, you saw that they were in cardiogenic shock," or anything like that, which is why I still like to work bedside too. So I can have those stories
yeah.
to incorporate in my education. But you can't just take a class or what your preceptor is teaching you at the bedside. You have to do some of it on your own. And I wish somebody would have told me that 24 years ago.
So it's almost like you're living and breathing the ICU through the whole training period. Like that's kind of you're immersing them in then and then you're having them like do homework and kind of doing things on their own and just for till their next shift they've got things that they are learning and absorbing. Like the best way to
As
get the
best
most
as
of
we
it.
can. Yeah, as
Yeah.
best as we can. And, I am, still having new grads that I'm teaching, and they're still having to learn how to be a nurse on top of these critical care concepts. One of the things that I always do in the beginning of my class is, all right, who had a cool patient or an interesting patient this past week? And then tell us about it. And then we get into this conversation like pathophysiology. We kind of nerd out with it and stuff like that as there. And then that makes the person in my class feel like, oh, yeah, see, I am an ICU nurse. Yes, you
Yes,
are.
the
Yeah.
comfort. Yes, yes. That's great. That's like rounding, right? When you do the
Right.
rounding, the purpose of, let's tell us your case, tell us how it went, and, being able to share that with other, you learn not just from your own experience, but even listening or telling your own story.
Yes. And 100%.
Yeah. Well, that's great. I hope that there's everyone like you at all the ICU places at all the yeah, and so you're an educator now, and that you've taken everything that you've learned all those 20, 24 years and
24. Yep.
yeah, and have
And
brought
I
it
have some
to
stories. I tell you,
yes.
I think I have at least one story for every day, sometimes multiple.
Yeah, yeah, I'm sure. I don't, is there any story that you want to share with us right now that, just some kind of good story or what you learned
Okay,
or
well, I'm a neuro
something?
nurse.
Okay.
So I'm going to share with you one of the stories that I love to share because we are a comprehensive stroke center. So we do thrombectomies where we can go up to the brain and actually pull the clot out. And very kind of close together in a couple months, I had about two patients who they were young, like 30s, early 40s, and came in with stroke symptoms, right? And who thinks at 35 or 38 that you're having a stroke, right?
Right.
So the one gentleman that I took care of, he like fell and kind of hit his head, and his wife was trying to call him, and she finally got a hold of him, and his speech was a little slurred, and he was like, "Oh, I'm just really tired. Like I just fell. I think I'm gonna lay down." And she got home and looked at him, and she's like, this is not normal. So she got him to our sister hospital, and they saw that he had a stroke. They gave him, at the time it was alteplase, right, the clot busting medicine, and then they put him in an ambulance and sent him to my hospital, and they went directly into the interventional radiology suite. They had a successful thrombectomy. They took the clot out of the artery in the head. And, his symptoms were right-sided weakness, garbled speech, and he, like, fine motor was having issues. 38-year-old man, father of two, married. Thank God for his wife, right?
Yes.
But then by the time he came to me, after we got the clot out, this is immediately post procedure. Speech is clear, can move his right side, and he made a full recovery. That's a good day at work, man. That's
Yeah.
where you were part of that, making a difference for that person, because stroke is the most debilitating disease out there. People survive it, and then, they can't move their right side, or they can't talk or anything like that. So, the fact that it was
Yeah.
recognized quickly, he got to the hospital, we were able to treat it, he had a good outcome. So I left that day jazzed about being a neuro nurse and like, yes, this is why we do what we do right here.
Yes, no, it's a really good story, and technology and everything that's happened in medicine and the care that
Yep,
the patient's getting. And that was definitely a team approach, right? With the wife being the first
for
part of
sure.
the team, finding
And the fact
and
that she knew
recognizing
stroke
it.
symptom, right? She
Yes,
knew it wasn't right. And
right,
so that's, another passion project of mine is to make sure that people know the signs and symptoms of stroke. Be
right.
fast. Be
Yes.
fast for all my
I
new
like
nurses out
that.
there.
Right. AST, right, right. No, I agree. I think I shared with you, I did pediatric neurology
Yes.
and then
Which God bless you for that.
and and then later in my career when I worked with pediatrics more too, and people would, be surprised we're in a setting where they didn't expect to have a child who had had a stroke. And recently I saw a post from one of the children's hospitals that were trying to do more awareness about it because
Right.
they happen for kids too,
Uh,
unfortunately.
it's so,
So
yeah.
yeah. So yeah, that awareness, I know that all the what is the good for social media, right? We sometimes think
Yes.
negative about it or what, but I mean that is definitely a good place to put awareness for things on,
Yes.
the acronyms that people can recognize in for strokes and for the
Yep.
other areas too, that people that are lay people
Right.
can recognize and act on.
Yes. Agree. 100%.
Right, right. Okay, so we've talked about a lot of good things already here. And
Yes.
how about certifications? Like if we talked about like what they could do to go in that direction of being an ICU nurse,
Mhm.
nurses who that is their goal. They want to be an ICU nurse. Everything that you're telling them that they're saying, yes, that's me, that's what I want, that's what I want to do. We've said, try a step down, look at the YouTube videos,
Yep.
start, maybe even if you're on a unit and not in that capacity, just looking at the environment and being part of the environment. But what certifications can
Mhm.
somebody get also to prepare?
Well, so as a step down nurse, the AACN, the American Association of Critical Care Nurses, they offer certification not only for critical care nurses, that's the CCRN, but they also have progressive care certified nurse, a PCCN. So that could be one certification you could look into before going into the ICU. They have medical surgical nurse certifications. There's all sorts of different certifications out there, and a lot of facilities now are offering either reimbursement for taking the test because the test costs a couple $100 usually, depending on what you're doing. So either reimbursement for the test, or my facility offers vouchers up front where you don't even have to pay anything out of pocket to take the exam. So definitely look into like the governing body for whatever specialty you're in, whether it's step down or medical surgical, because there are tons of certifications out there. So then the question is, well, why do I need to get certified? What does that do for me? Well, I mean, I like the alphabet soup behind my name. I think that makes me just feel good, right? But what does it take to pass the test for the certification? You have to have a deeper understanding of your specialty, whether it's step down medical, surgical, or critical care. And having that deeper understanding will make you a better nurse, right? So if I had to learn the different shock profiles for hemodynamics as a critical care nurse, which is part of the CCRN exam, a big
Mhm.
part of it. Will I take that information, that knowledge, and take it to the bedside and be able to recognize that my patient's going into septic shock or cardiogenic shock early? And then I can let that provider know, right, that I caught this. Hey, my patient's blood pressure, like their diastolic is low, they're tachycardic, they're, getting a little febrile. I'm concerned they're going into a septic shock, right? Not that you can't have that information without a certification, because you absolutely can.
Right.
But it's the preparation for the certification, that knowledge that you're going to be obtaining by studying for your certification. That is where you're going to make the difference. You can be a fantastic ICU nurse and not have your CCRN, right?
Right.
But if you're a patient in the critical care unit and you got to pick your nurse, and you had a nurse that had their CCRN
Hmm.
and you have one that doesn't, which one do you want?
Right.
You probably want the one that's certified, right? Not to
Probably.
say that that other nurse is not fantastic, because they probably
Right.
are, right?
Right.
But there's a prestige that comes with it as well,
Yeah.
right? That shows that I took the time to be good in my craft, to be good in my um, service line, that I am now certified in it, right?
Hmm.
So You don't have to get it. Nobody makes you, but does it kind of elevate you as a nurse, be more marketable, to go get a job somewhere or something like that? Yeah, absolutely. There's definitely benefits to being certified beyond just the knowledge that you get, which is 100% worth the time
Right,
to
right. And
to
I like how
study
you
and
said,
take the test.
yeah, and I like how you said that just the fact of studying for it,
Yeah.
just learning everything that you can. And I also like that your hospital takes the cost out of it because I mean, that's a lot of work to do, and then you have to pay for it too. And yes, there's benefit in doing it, but if you can
Yes.
get that cost taken care of up front, that's great.
Yeah, there's a lot more incentive out there now to be certified. They even give bonuses for when you get certified at my facility.
I've noticed that too a lot lately in all specialties, across all specialties. I'm
Mhm.
seeing that too, that there is a push for the nurses to become certified.
Yeah.
So, you'll have the nurses that are being certified in different areas that it's offered in. And yes, it's saying that you are certified in that specialty and
Yes.
that have understanding of it and everything that goes with it.
Yes.
So,
Like I said, it's like kind of like a badge of honor
yeah.
because the CCRN was not an easy test, I'll tell you.
Oh, I know that. I
Yeah.
haven't taken it, but I have heard on that one that that is probably one of the hardest tests
Yes.
to take in the
So
board
when you get it,
certification.
you wear it proudly on your chest. Yes, I have my CCRN. Thank you very
Yeah.
much.
Did you see it?
Yes, exactly. By the
Yeah.
way,
Right, right, right. So it's obvious that there is an emotional toll a lot of times too. Sometimes, how do you deal with that? How do you help other nurses deal with that emotional toll that can happen working in your environment?
yeah, very much so. And I think not being in it full time, like at the bedside full time, has definitely helped me. But we compartmentalize a lot. So, you can have your patient in one room who you just coded for 20 minutes and, they passed away. Then you have to turn around and go into your other patient's room with a smile on your face as if nothing happened. So that kind of can really take a toll on you if you don't take care of yourself outside of the four walls of the hospital. So that means not working 6 shifts a week, right?
Mm-hmm.
You not to say you can't pick up overtime, right?
Right.
But you have to be able to give yourself time to rest, eat right, not to make this a preachy moment, but you got to exercise, take care of yourself mentally and physically when you are any nurse, really, because nursing in and of itself is very difficult, let alone being a critical care nurse. When I was at the bedside, I had a nurse friend that she would be my debrief person. You know, if I had a rough shift, I'd call her at the end of my shift and we would kind of debrief about the day. So having somebody that understands, like, you don't have to explain the medical jargon to them. I can just tell you, yeah, we coded this patient for, 20 minutes today. And, um, it was really crazy and they understand. I don't have to explain things to them. It makes it a little bit easier. So finding a nurse buddy, to debrief with is definitely one strategy, and not taking it home with you, which can be really hard. There there are patients in my years of nursing that I can still see their faces, you
Mm.
know, and I will live with those memories for my entire life. But I do think that those moments make you appreciate life a little bit more. That tomorrow's never promised. So to make sure that you are, living each day as if you could be that critical care patient the next day. So diet, exercise,
Yeah.
praying,
Yeah.
whatever you need to do, to just make sure that you're taking care of yourself mentally, physically, and spiritually is really important.
Yes, I think that, we don't talk enough about the mental health aspect for everyone,
Yeah,
and I think we do need to more to do that. And I do like
I
the nurse
agree.
buddy. I think that's a great advice for any nurse to find a nurse buddy, even if it's
Yeah.
not somebody within. I've been a nurse buddy for people, when I was like a manager.
Right. It
And
can be like your mentor, anybody, your
right,
preceptor, if you have a good
yeah,
relationship with them. I think
right,
you're right. COVID, I think, really exposed the mental health aspect of nursing.
hmm,
I mean, I think even I have a little bit of PTSD when we start talking about COVID. I can feel the emotions kind of rise up because there were many things that healthcare providers who were at the bedside and in critical care of the emergency room, we saw things that I don't think any human being should ever have to be able to see. I think that that did put a spotlight on the mental health, but I agree with you. I think that more needs to be done to protect the mental health of nurses and all healthcare providers, really.
yes, yes, for sure. And I have noticed that, that is definitely a mark now that we talk about, when we talk about things in nursing, it's always pre-COVID and then,
Pre-COVID,
yeah,
post-COVID.
and
Yep.
post-COVID, and we're just still trying to wrap ourselves around that. But very important to in moving forward, having those people around you and having all the
Yes.
balance that you were just kind of talking about as well.
Yep.
And
Yep.
so important. Don't dismiss it. Find a person, find your balance. Sometimes
Yes.
people, I've talked to a lot of people too that have had to step away from nursing and then come back. And so, if that's something you've got to do, nursing's still here and you can get
Yes.
back. That's one of the
Yes.
actually as a career coach where people get scared that if they
Yeah.
leave, they think that they can't get back, but they can. So,
Absolutely. There is some sort of nursing out there for everybody, which is one of the things I love about being a nurse is if psych is your thing, pediatrics is yours, right? Adult ICU is mine. You have school nursing. Yeah, there's so much stuff that you could do with your nursing career. You can be a legal nurse consultant, right?
right,
There's so many things that
right.
you can do.
Yeah,
So,
yeah. Yeah, we're gonna have them all here on the podcast.
yay, that's exciting.
You mentioned a couple already. I'm like that we've already have scheduled, so I'm really excited about that. But yes, there's all areas of nursing and important to, yeah, maybe go into a different area for a little bit if that's something that you want to try. The focus changes, the specialty
Yep.
changes, but your skills do still, transfer.
Yeah. And
So,
as your life changes, your specialty that you're in might not fit your life anymore.
right.
So, and that's
Decisions
again,
that,
the great thing about nursing is that you can go find something that you will love.
right, right.
I was very fortunate to find it early in my career.
Yeah, and you've grown within it too. And that's the other questions I usually ask, but it seems pretty obvious is what is the opportunities for growth? Now, if someone has a solid background though in the ICU, those are like the opportunities to do things that like people talk about events, they can go and be an event person or
Yeah.
some other type of nurse. What have you seen people like go to
Oh
and
my gosh. There is so much. So, probably the most common is if for my CVICU nurses, I would say at least 50% of them want to be a CRNA when they grow up.
mm,
So they come to critical care, especially CVICU. They get their 2 years of experience and then they go off to CRNA school. So that's a really big one. Others are, advanced practice nurse practitioners, right? So, and some of them work in geriatrics. Some of them are critical care nurse practitioners. So they just go on to, get their advanced practice license and still nurse that way in that capacity. I have um, medical device reps, right?
hmm,
So a lot of and I deal with a lot of them now, especially as an educator, right? Because you
right.
need to train me as an educator on this medical device. And so many of them have critical care nursing background. And, now they're selling medical devices and teaching nurses how to use them.
Right.
Um, could be an educator like
Yep.
me, right?
Yeah.
And there's, not only facility education, but you could be a nursing school faculty, right? And not be even in the hospital anymore. You can just teach in a classroom or in a simulation lab or anything like that. So there's really a lot of opportunities for critical care nurses once they, want to leave the bedside.
Yeah, I love that. That's good to know that you gave a lot of options, and I'm sure there's more we didn't talk about
Oh my gosh, as I'm sitting here, I have more going off in my
Right.
brain.
So is there anything that you want to mention before we close? Because I could talk to you all day, to be honest. I mean, I always like, when somebody has the passion for what they do, and I can definitely see that you have a passion for what you
Yeah.
do. And
I love my job. I can honestly say that now. I'm very blessed. I'm very fortunate to be able to do something that I love and work in the environment that I love, which is critical care. I love all things critical care. The all the toys that we have to play with, the knowledge of the body and everything that happens inside of it that you have to have as a critical care nurse. And I feel like there is a certain level of respect, like when I say I'm a critical care nurse, it's like, oh, so that's always nice too. You get respect from other healthcare professionals like physicians and stuff like that. They respect your opinion when you are talking to them about patients and stuff like that. So I guess the one thing I would like to leave with is, if you are interested in critical care, ask yourself why. Because if it's because of the nurse patient ratio, you're going to be severely disappointed, because you are still going to work very, very hard. Make sure you have a good support system, because you are going to need it, because critical care can be good, but it can also be very, very sad.
Mhm.
And find yourself a good ICU educator that will pour into you and give you knowledge and be a mentor for you. And yeah,
Yeah.
so I hope that we get some nurses who uh, want to dive into the critical care realm, and I hope that we were able to give them some good information on how to do that today.
Yeah, I think, when you're a nurse and you find what excites you, like, because this isn't memorization. This is understanding of the body and what's happening and
Yes.
what's breaking down and what you need to do to counteract, etc. If you're a nurse that is just like really loving that, everything about it, all things, that are going into critical care, then yes, that is the area for you. Dive in fully and be immersed in it, and do it. And so, yes, there
Yep.
is nurses that we want over there. And if that's not you, then find somewhere else, because there's
Right.
endless opportunities when you're a nurse.
And for any nurse that is out there, don't forget about why you became a nurse in the first place. There's so much going on in healthcare right now, between staffing and, going where the money is and all of that. But why did you become a nurse in the first place? And usually a lot of people have personal stories and personal experiences that drove them to be a nurse. Never let go of that. Never lose that. You have to remind yourself of it in those really hard times when you're frustrated with leadership, or you feel like you're not being heard or seen, or you feel like you're being, taken advantage of. Um, why are you even there? And it's usually to make a difference in people's lives, because you love people and you have compassion for people, and you want to make a difference. So I would just say, don't ever lose that.
No, for sure, for sure. Always know your why, and then do find the area that lights you up. And
Yes.
if it's somewhere, in some place other than critical care, then go that direction. But if it is critical care, know that, you get into a good program with a
Yep.
great nurse educator and hospital that supports that,
Yes.
and go for it. Go do it. So,
Yes.
um, is there anything else you want to say? Because like I said, I could
I
talk
don't
all
know.
day
I
with
think
you.
I could probably talk to you about critical care nursing all day long, but
All day long, yeah.
yeah,
That's it.
but I
Yeah.
think, yeah, just what you said there at the end, and making sure that you continue to remember why you became a nurse in the first place. It's the most
Yeah,
important. Like, if anybody takes anything away from this, take that away.
I agree. Take that away. Okay.
Mhm.
Thank you so much for
Thank
joining
you.
me and for all the information that you gave.
It was my pleasure. I really enjoyed this. Thank you so much.
Thank you. I hope what you heard today gave you real insight into this specialty and helped you see what's possible for your nursing path. Please subscribe so you don't miss what's next. And tell me, what specialty should we feature next? If you're a nurse in a unique specialty that you'd love to share, apply to be a guest on my website. I'm Coach Rebecca. Until next time, keep exploring.